Welcome to my show. I am with a guest here. Her name is Amanda Harris. Amanda, how you doing, ma?
I'm doing well, thank you. How are you?
I'm fine. Thank you very much, ma. Firstly, I want
Great.
to go to your background. You have some degrees. You have a master degree in
hmm
exercise philosophy from the University of Virginia. You're also a certified medical exercise specialist in Austin, Texas. And you're also a
hmm
certified red cord active specialist. I want to
Right.
ask your journey, what inspired you, and how you're doing currently now, ma.
You're asking what inspired me to do this work that I do?
Yes, ma.
Well, basically, it started when I had a back injury when I was in college. I had an injury that created a lot of pain in my lower back. And every time a physical therapist would work with me, and I would work with them for 12 weeks or so, I would get better. But then when I would go back to doing my exercises, like my workouts in the gym, I would get worse again. And so I started trying to figure out how I could heal my own back because I really believed that movement and exercise were the answer, but I had to figure out what the right movement and exercises were. And that's really what started me on the journey. I was already interested in teaching exercise, but I didn't realize I would become a back pain specialist until I had to deal with my own back pain. And so that's really what got me going. And I'm happy to say I found a method that did work between working with a couple of doctors that understood where my pain was coming from, and then also um, learning from those doctors how the body really works and starting to really focus on the nervous system, the brain, and the spinal cord, and how they tell your muscles what to do instead of focusing on the muscles, which is what we usually focus on when we work with exercise, right? And fitness, we think about muscles. And so what I had to learn to do is stop focusing on muscles and focus on how my nervous system was ordering my muscles to move, right? And so that has been my journey, and that's what really got me going, because once I was able to heal my own pain, then I realized I could help so many others heal theirs.
All right. Thank you so much, ma. And congratulations on your back pain, ma. I want to go to the point
Thank you.
of posture. I want to ask, like lifestyle factors, which are posture. How do you think it
Mhm.
does contribute to back pain, chronic back pain, ma?
Well, it absolutely does contribute to back pain. The problem with posture is we often think that posture is static, that it's something that we just have, that maybe we were born that way. But the reality is that posture is just a series of habits. It's the habit of how you hold yourself up. And so, to that end, posture can be taught, it can be relearned, and you can improve how you hold yourself up by using different exercises, but also by being more aware of where the problems in your posture are. So, for instance, you and I are sitting to have this conversation, and it would be very easy as we're sitting here to start to allow ourselves to slump, right? To bend forward and round the shoulders and even let the head ride forward. And over time, that can create pain. So we wouldn't sit there like that for long, but it could happen. I mean, would it not? It could happen that if we sit here often enough and have conversations, that you and I get into a rhythm of we start by being very upright and then we gradually start to fall and slump and round, right? We start to collapse. And our bodies start to learn that that's easier to do, to collapse and round the shoulders, than it is to use the effort of holding ourselves up. And so over time, we develop that posture. But you and I can also change that posture simply by maybe we remind each other or we remind ourselves Hey, sit up a little bit, Tempe. Or you could say, hey, Amanda, sit up a little bit, and we can help each other out. Or we just have to remind ourselves, hey, when I'm sitting this long, I have to remember to sit up a little straighter. But you can teach yourself how to use better posture. But to your point, that posture over time, the habit you use, how you sit, how you stand, can absolutely create back pain because you ultimately are pulling on some parts of your body and then you're collapsing others. And that hurts, right? Over time, that hurts. So, yes, posture definitely factors into back pain. And so, part of my work is helping people find a better alignment, a better way to hold themselves up so that their posture doesn't hurt them, right? Yeah, it's a good question.
Yes, thank you so much, ma. I really appreciate it, ma. And I want to go to because I heard you said during that time the doctor said you should not focus on your muscle, you should focus on your nervous. So I want to ask this muscle, the imbalance, when muscle is imbalanced, when you make your muscle imbalanced, does it lead to chronic back pain?
It absolutely can. So, muscle imbalance simply means that you've got some muscles that are working very, very hard and other muscles that are not doing much of anything. And that can be a natural sort of result of having back pain over time. Your nervous system, your brain, will actually turn certain muscles off. We say it deactivates certain muscles, especially the ones that are closest to your spine, the ones that typically help to support you and hold you up. Some people call them postural muscles. So those muscles often get turned off by the nervous system as a reaction to back pain. And then you say to yourself, well, why? That doesn't seem to make sense. But what your nervous system does to compensate for that, to make up for that, is it reassigns some of your outer muscles, like your lower back muscles and maybe your hip flexor muscles, the muscles right in the fronts of your hips, and tells them to grip to try to brace you and keep you from being able to move much at all. And this is a protective thing. It's the way your body protects itself from you hurting your back worse. But if you've ever had back pain and you've had those muscles that are so tight, then you know that doesn't feel good. And it hurts because we want to keep doing things. We want to keep being active. We need to walk. We need to sit and stand and climb stairs. And so it doesn't work to have those gripping muscles. But that's the kind of imbalance that leads to more and more pain. And unfortunately, what we've learned to do, because you went back to this notion of it's not the muscle, it's the nervous system. So what we've learned to do because of our habits with exercise is we say, okay, when these muscles are very, very tight, we need to stretch them, right? That's what most people think. And then they also think when those deeper muscles are not working well, we must strengthen them, right? We need to train them to be stronger. And the problem with all of that is, again, we're focusing on the muscles. So, what we must do is understand what's happening in the nervous system, which the nervous system is protecting us. And so, what I've learned to teach people to do, Tempe, is I get them to do a very gentle exercise, like lying on their back and learning how to activate, how to use those very, very deep muscles that are closest to the spine in a very gentle way. So the body doesn't feel like it needs to protect itself so much. And usually, as we start to get those muscles working again, all that tightness around the back and the hips starts to melt away. No stretching needed. Sometimes we stretch a little, but the focus is on getting the nervous system to get out of that high protective mode, that high stress mode, and get the body back to where the muscles are more balanced. So we have the deep muscles working well, and then your movement muscles are able to move you again. They're not just tightening. So that's really how we do it. It's um, the focus again is on the nervous system's reaction and not on trying to strengthen a muscle that is turned off. Yeah.
Hmm. I learned that. Thank you so much, ma. And I want
Hmm.
to go to the points of, people maybe call you a witch, maybe because you do some miraculous things when it comes to pain. So
Yes.
how does that miracle happen, and why do people just call you something like that, ma?
So it's kind of a joke, about I must be a witch because they've been in pain for so long and they've tried all these things and they haven't been able to get relief. And then sometimes, not always, but sometimes within an hour of my working with them, they're walking around without pain. And it feels like a miracle, but it's not a miracle, it's science. I'm just using science, right? Um, but I've been called a light witch, only light magic, only good magic, never bad magic. So yeah, so sometimes I've been teased and been called a witch, but it's just because the nervous system is like a big switchboard. Do you know this word switchboard? It's like a
No.
switchboard. So it can turn things on and turn things off very quickly. And when we focus on muscles and we talk about building strength, that takes time, right? And so if it was a strength problem, I couldn't make that change for someone in an hour. I mean, realistically, they make the change. I'm just walking them through movements that I'm asking them to do, and their bodies are the ones that make the change, not me. But if it was about strength, it would take weeks and months, right? But it's not about strength. It's about turning things on that were turned off by your brain and turning things off that have been stuck on by your brain. And then once we're able to do that, we're literally convincing your brain that it's okay to go back to balance. Then there's no pain. Now, keeping that is another story, right? So, keeping that is harder because once they get up off my table and they're walking around, they start doing things again, cleaning their house, working in the yard, working in the garden, whatever they're doing. And it can all start to try to come back. And so part of what I have to teach them is how to gradually increase the effects of the exercises until they can tolerate being in the yard, being in the garden, cleaning the house without their back getting angry again. Yeah, so it's not like they have one session with me and they're done. Often they'll have one session with me and feel a huge difference, but then to keep that lasting, I have to teach them how to gradually increase, right?
Yes,
Make sense?
make it very big sense. It makes me learn something that there can be some things someone can do to just relieve some pain when it comes to back.
Yes.
I thank you so much, ma. And I want
Yes.
to go to the point of obesity. When someone is
Hmm.
very fat, do you think it's also, does it has a role in lower back pain? Can it affect lower back pain when someone is too fat, when someone is obese, ma?
It can. And I have to be very careful here because I don't believe that the obesity is what causes the back pain. And I say that very carefully because I know people who are quite obese, but they move very well. And then I also know people who are quite obese that don't move. You might know some people too, right? They
Yes.
don't move much at all, and they sort of feel like they can't, so they don't. And the less they move, the heavier they get, and the harder it becomes to move. And these people are probably giving themselves a muscle imbalance, right? We talked about posture earlier. So too much sitting can also cause back pain, and so they start to find themselves in that same muscle imbalance I described earlier, which makes them not want to move, and it becomes this downward spiral. But I do know people who are quite heavy who have kept moving and move well, and their weight doesn't seem to be a problem for them. So it really does come down to how well do you move? Are you move Is your nervous system working in a way that keeps your muscles in balance so that you can move efficiently without pain? And if it doesn't, let's fix that. But I don't know that I've ever told someone you have to lose weight to heal your back. I might tell someone you need to move more, right? I need to teach you how to move well, and then you need to move more. But I don't know that I've ever had to tell someone, you have to lose weight to move to fix your back. There are probably some exceptions, Timby, but that I don't know that I've ever had to tell someone that. And I've seen some pretty large folks, so. But
Yes,
that's a
yes,
good question too, because it often gets blamed, doesn't it?
yes, exactly, man. And
Mhm.
I want to go to surgery. Some people do surgery when it comes to back pain. Do you
Yes.
think surgery like spinal fusion, do you think it can lead to long-term issue when it comes to that back pain?
So I will give you my opinion, and
Yes,
my
ma'am.
disclaimer is that I am not a doctor. So I
Okay.
want your listeners to understand that. But what I have seen, and what most good spinal surgeons will tell you, is that spinal surgery is not necessarily going to solve back pain for the long term. In some cases, it can solve back pain in the near term, meaning if you have, a piece of bone or a piece of disc sticking out that's pushing on a nerve and that's causing a lot of pain, sometimes the surgery will take that pressure off the nerve and then the back feels better in the short term. So here's the problem: if that's the reason the person got the surgery, they're going to wind up disappointed, because if they were having back pain before the surgery, they have also gone into that muscle imbalance we talked about, right? And so even when the surgeon does an amazing job, like does a really good job with the surgery, and there's nothing pressing on the nerve, if they haven't changed the way they move and they're still moving with all those muscle imbalances, they are likely still going to have pain. And I see a lot of those people, and they're very frustrated. And they will say to me that something went wrong with their surgery, but nothing went wrong with their surgery. They just didn't change the way they were moving. So, the other thing that surgeons will often tell you is that once you start having a back surgery, you're going to have to go in for another one, and then another one, and then another one. Have you heard this? And the reason is that if they have a fusion, like you mentioned, a fusion where they've taken two motion segments and they have basically surgically pinned them, right? They actually put rods in to keep those two segments still, keep them from moving. Then what happens is it creates an unstable area right above that site, right? So the whole reason the person had the fusion was that those segments were unstable. They were wobbling and causing some pain. And so the surgeon fuses them, and then the next thing that happens is the segment up above starts to move a little too much because these segments below can't move. And it's because the human body moves. I mean, we just move. So it's very difficult for people to hear that, and often they don't want to believe it. But most good surgeons will tell you, yes, once you've had one spine surgery, you're going to need another one, and then another one, and then another one. Now, I have been able to help people delay that, keep that from happening so soon by learning how to move better and also understanding where their fusion is and how they can avoid moving too much around that area so they're not putting pressure on that next area. But it takes a lot of attention and a lot of focus to do that. So yeah, the fusions can set you up for a problem down the line, and sometimes it's the only way to keep that person, upright and moving. So, sometimes it's the only choice, and we have to understand that too, but I always tell people, don't let it be your first choice, because sometimes folks will get frustrated with this sort of work and they'll say, I wish somebody would just fuse all this. Like, no, 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 you don't want that. that's that's not the that's not the solution. Fusion is for someone who is so unstable that they could really hurt their spinal cord, not for someone who just hurts. Like, we can do so much more without a surgery if you're just hurting. Yeah.
Yes, thank you so much, ma. And
Mhm.
that brings me back to general advice. I would like
Mhm.
to ask Mrs. Amanda, if there is any advice you would like to give to the audience, ma'am.
I think my best advice is do your best to move in a variety of ways and move every day. So, modern life has us sitting more and more, right? Even in your country, people are sitting more and more. And that comes with a price because the less we're standing and walking and moving around, the less we're picking things up and carrying them around and reaching up overhead and turning around. The less we're doing this variety of movement, the more these aches and pains show up, right? So if your audience, if my piece of advice is this, learn what movements you generally do in a day. And at least here in the US, a lot of us sit a lot and we work with our hands out in front of us a lot. I mean, I think that's a human thing, don't you, Tempe? We
Yes,
work
ma'am.
with our hands out in front of us a lot. What we don't do a lot is we don't backward bend a lot, right? We don't bend
Yes.
backwards a lot.
Mm.
We don't turn a lot. We don't rotate a lot. And we don't reach overhead a lot. And so I try to help people understand these are the movements that you need to practice if your day doesn't make you do them. And those sorts of movements keep your body healthy and keep it moving efficiently and keep your nervous system working to really stay in balance, right? So that's really my biggest piece of advice is, on the preventative side, keep moving and add variety to your day.
Thank you, Mrs. Amanda. I really appreciate, ma. And there's a
My pleasure.
question I normally ask, ma, from the ancestors, from the forefathers, if there is anything you would like to bring back to our time today from the past, what do you think that thing would be, ma?
Oh my goodness. I love this question. Meaning things that we could bring back that we no longer do.
Yes, ma.
Oh, there are so many. Um, and I think there are opportunities for this, Tempe. I think we just now we have to look for the opportunities, but the opportunities to go on long walks, whether they are, our ancestors may have hunted, right?
Yes,
And walked great distances or even run great distances hunting.
yeah,
But can we go for long walks out in nature, right? And be outside and be out in nature. And while we're out there, can we do different things? Can we, you know, walk over rocky terrain and scramble on rocks safely and reach up in a tree to grab a piece of fruit or even climb a few branches in a tree to grab a piece of fruit? These are the sorts of things that I wish we did more, or have the patience to pick berries off of a bush and put them in a big jar, instead of just getting a carton of them at the grocery store.
yeah.
Those are the sorts of things I wish we could do more of. That's a great question. I love that.
Yes, ma. Yes, ma. Thank you so much, Mrs. Amanda.
Yes.
Mrs. Amanda, sorry. I want to thank you for your time, for your patience, and for making our meeting a successful one. Thank you so much, ma.
It's my pleasure, Tempe. Thank you for having me on your show.
All right, bye bye. Love you.
All right. Bye bye.